Is this your first week home with baby and are you wondering if they're getting enough food? Today's episode is all about what you can expect for normal feeding in the first week of life.
Welcome to the Beehive Doc Talks with Dr. Blair Rolnick. As a pediatrician and mother herself, Dr. Rolnick is here to answer your most pressing parenting questions and guide you through the tough spots.
Welcome back to Be Kind Pediatrics. For those of you who are new to the show, my name is Dr. Blair Rolnick. I'm a board-certified pediatrician and mom myself. Today, I want to talk all about what you can expect for feeding in the first week of life. I find that a lot of parents don't think about or anticipate this until baby is ready, and then they have a ton of questions when they leave the hospital. So this episode is really geared towards expecting parents and empowering you with the knowledge ahead of time of what is typical and expected for your newborn in the first week. So firstly, I think it's really important to establish that newborns' feeding schedules are very variable and they are not going to be on a structured routine for quite some time. But here are some good general guidelines. Let's start off with the breastfed babies. So for breastfed babies, typically they're going to be eating every 1.5 to 2 hours, and they are typically going to spend 10 to 20 minutes on each breast. So that means if they're spending 10 minutes on one and then 10 minutes on the right, that's 20 minutes total, but they could be spending up to 40 minutes total breastfeeding. If your baby is taking less than 10 minutes to finish breastfeeding, so they're taking 5 and 5, or they're taking more than 20 minutes, 30 and 30, I really recommend that you reach out to your pediatrician. While that may be normal for your child, it also may be a sign that they are not getting adequate milk transfer. So this is a child I would typically recommend coming into my clinic for a weight check just to make sure that they are gaining good weight. And I just want to have a note here on cluster feeding because this is a common follow-up question I get from newborn parents. Cluster feeding refers to a period of time when a baby wants to eat more frequently. This typically occurs in the evening or overnight when milk production is at its highest. And this may be a way of your newborn stimulating more milk production. So typically this happens when a baby is going through a growth spurt. They can also, babies sometimes cluster feed, also sometimes for comfort. So for example, when they're teething. Typically cluster feeding lasts a few days to weeks, and then your baby's feeding pattern adjusts. I do recommend that if your baby is cluster feeding in the first week of life, that you reach out to your pediatrician. And again, the reason for that is we really want to make sure that they are gaining good weight and that they're not cluster feeding to increase milk production because they're not getting enough milk. So have a low threshold in the first week if you think something's abnormal with your baby's feeding to reach out. But again, for breastfed babies, typically they're going to eat every 1.5 to 2 hours in that first week. Typically they're going to spend 10 to 20 minutes on each breast. And if you're seeing cluster feeding or they're taking a really long time to feed, or they are taking a really short amount of time to feed, or they're eating like every 30 minutes to every hour, just reach out to your pediatrician and make sure everything's okay. So now let's switch gears and talk a little bit about formula-fed babies because their feeding patterns are actually slightly different. So formula-fed babies typically eat every 2 to 4 hours, and they consume anywhere from 1 to 3 ounces of milk, which is 30 to 90 mLs of milk. If you're bottle feeding your baby express breast milk, they may then follow more typical breastfeeding patterns. So they might eat every 1.5 to 3 hours. And typically they're going to be on the lower side, like maybe 1 to 2 ounces of milk. In the first week, generally formula-fed babies are going to eat closer to every 2 to 3 hours. And typically they're going to have 1 to 2 ounces, although they might sometimes be taking 3 ounces every 3 hours. If your baby is really eating more than 3 ounces, again, I recommend that you check in with your pediatrician, especially if you're seeing signs of early regurgitation or reflux. So we have a whole episode on reflux and what's normal. Feel free to check that out. But if your baby's eating more than 3 ounces, just check in with your pediatrician, either that first wellness or the first week visit, to make sure that you're not overfeeding them. So how much and when do you feed your baby? So at this age, again, your baby should really not be on a set schedule. Instead, you want to be learning their hunger cues. So those cues might be things like lip smacking, sucking on their fists or hands, or rooting, meaning turning their head towards their caregiver. I also want to pause and make a special note here that as babies get older, they will put their hands in their mouth. And it does not necessarily mean that they are hungry. It's just a normal part of our sensory development. So as they get older, you will start to learn their hunger cues better. And it doesn't necessarily mean that you need to feed them every time they're mouthing their hands. In the first week, err on the side of caution. If they're putting their fists in their mouth, offer them a feed and see if they're hungry, especially if it's been a few hours since that last feed. Crying is a really late hunger cue. So once your baby is crying, I recommend it for breastfed babies that you actually try to soothe them first, because it can be very difficult for a crying baby to latch to the breast. So if they're crying, just try to get them calm and soothe first and then put them to the breast. And we've got a great video on soothing that you can reference for how to do this. So how do you know that your baby is getting enough food? First, and most importantly, we're going to ask you to monitor their diapers. So that's going to start the day that they're born in the hospital. So what should you expect in the first week for wet diapers? Typically on day 1, you are going to expect 1 pee and 1 poo. The pee is going to be very small, like a teaspoon amount. So I really recommend that you get diapers that have a wetness indicator, because if the pee is mixed in with the poo, it can be hard and you might miss the pee. And if the pee is very small, you might not see it or smell it. So sometimes your only clue is that little tiny wetness indicator. Day 2, you're going to expect 2 wet diapers and 1 to 2 stools. Day 3 to 5, 3 wet diapers and 3 to 4 stools. And then day 5 on, we're really looking for 6 wet diapers or more and 4 stools or more a day. And typically by day 5, the stool should have changed in color. So it should become more yellow and seedy and less tarry and black. Those are all great signs that your baby is getting enough breast milk or formula. 2, your baby's body language after they eat. So your baby should be relaxed following a feed, meaning you might notice your baby's hands are typically in fists. So after feeding, their hands might be relaxed and open. Their muscle tone might be more relaxed. They might be even sleeping. If within 30 minutes to an hour, your baby is crying and seeming hungry again, I would reach out to your pediatrician. They may want to bring you in for a weight check. And 3, weights. So I always tell parents, please do not get a baby scale and weigh your baby at home. Let us worry about your baby's weight, but we will be tracking your baby's weight. Typically in the first days of life, a baby will actually lose weight. So between day 0 and 5, most babies will lose weight, some excess fluid that they've had. Generally, we allow up to 10% of their body weight as an acceptable weight loss. Typically by day 7, babies will start gaining weight and they will typically regain their birth weight by 2 weeks. Again, this is not something I recommend parents keep track of at home. This is something your pediatrician should be keeping track of. But those are kind of the 3 things we're looking for as pediatricians to make sure that your baby is getting enough food. How many wet diapers? How are they acting? How often are they feeding and how much? And what are their weights? And then lastly, of course, if you have any concerns about your child's weight, their feeding parents, you should feel very comfortable getting in touch with your pediatrician. They are more than happy to provide you guys with support and guidance and help you get, if you're breastfeeding, in touch with a lactation consultant potentially to get you feeding on the right schedule. I hope that you found this video helpful and constructive. If you guys liked it, feel free to please subscribe or give us a like. If you have any questions or concerns, as always, please leave them below.
Thank you for watching The Beehive Doc Talks with Dr. Blair Rolnick. For more episodes and her practice, visit BeKindPediatrics.com and don't forget to subscribe for more parenting tips wherever you get your podcasts. This information is for educational purposes only. It is not medical advice. Always seek medical advice from a qualified physician.